In 1912, Congress granted the American Medical Association exclusive control over who could and who couldn't call themselves a doctor and practice medicine here in the United States. And since 1912, we've been under the jack-booted heel of a medical monopoly. And this monopoly is so overarching that most people aren't even aware that it's a monopoly. Now look, MD-directed allopathic medicine, which is in charge of the monopoly, is really good for surgery. It's really good for trauma care. It's really good for infectious diseases. But for most conditions that most people go to the doctor for most of the time, it's a horrible methodology. It's old-fashioned, it's outdated, it's ineffective, and it is the reason that chronic disease persists. It's not because you have a bad gene. It's not because you're getting older. It's not because of chemtrails. It's because your body has run out of the nutrients that it needs to maintain its structure and function, and you are unwittingly eating food on a regular basis, which is whittling away at the health of your body. If you put diesel fuel into an unleaded engine, it's only a matter of time until the engine doesn't work anymore and there's nothing wrong with the engine. Wrong fuel. If you never change the oil, never change the transmission fluid, never change the spark plugs, never change the air filters, the oil filters, the oil, something bad's going to happen. Not because there was anything inherently wrong with the car, but just because you didn't give it the stuff it needed. It's exactly the same with the human body. But the medical monopoly, run in large part by the pharmaceutical industry, doesn't want you to know what I and my colleagues know, and they've taken it to the extreme. In the United States, Canada, and the European Union, the only thing that can treat a disease is a drug. Now, says who? Well, if I discovered that there was a daisy, right? There was an extract of a daisy, the common daisy, that would cure pancreatic cancer, the Food and Drug Administration would make me spend $60 million to prove that, and then they would make the daisy medicine a prescription medication. You wouldn't be able to get it without a prescription. The only people that could make it would be the pharmaceutical industry, and you'd have to pay through the nose for it. This is why when you shop for health-related products online or at health food stores, it never says cardiomyopathy RX, asthma treatment, rheumatoid arthritis help. It never says that. It's bone and joint support, heart support, cardiovascular support, whatever, right? Because it is against the law. Against the law for anything but a drug to treat a disease. And this is a gigantic problem. And look, thank God for insulin. Thank God for lidocaine. Thank God for the sterile technique. We need to keep it all in perspective. There's room and a place for every different scientific discipline and medical methodology. But the medical methodology that's in place right now, that is in charge running the show, MD-directed, allopathic, pharmaceutical-centrist medicine, is horrible for the treatment of chronic disease. So what do? Well, we do what we can inside of the law, while we're trying to change the law, right? So the fundamental naturopathic belief is the human body knows how to fix itself, the human body wants to fix itself, the human body is trying to fix itself all of the time. If you cut your finger, do you have to tell your body to increase macrophage response time and increase T helper cell production and increase the production of fibrinogen to help the wound heal? No, you don't even know what half of that stuff is. You just keep it clean, put a Band-Aid on it, the body takes care of it. When you eat an apple, do you have to tell your stomach how to digest it, and your small intestine how to absorb it, and your large intestine how to get rid of it? No, it happens all automatically. There are literally millions of biochemical processes happening right now, and they're all happening outside of your conscious control. Naturopathic doctors, holistic doctors all around the world believe that the human body knows how to fix itself, the human body wants to fix itself, the human body's trying all of the time to fix itself. And it is the naturopathic doctor's job, the holistic physician's job, to develop and to deliver therapeutics which support and promote your body's built-in God-given ability to fix itself. But our hands are tied, right? Because of this crazy law. So what do? Again, well, we advise people, look, your body needs 90 essential nutrients. There are 90 essential nutrients that your body needs in order to function optimally. 60 minerals, 16 vitamins, 12 amino acids, and 2 essential fatty acids for a grand total of 90. But these 90 nutrients are not all present in the food. Some of them are, most of them are not. So as time goes by, your body becomes more and more deficient in essential nutrients, and then things start to break. Your car becomes deficient in oil and transmission fluid, things start to break. It's the same thing. So the first step towards optimizing your body's God-given ability to fix itself and optimize its structure and function is to provide it with all 90 essential nutrients. Now, I've been doing this for 30 years as a licensed naturopathic doctor, 30 years of treating real patients with real illnesses with science-based, clinically verified naturopathic medical therapeutics. That's a pretty good track record, if I do say so myself. The supplements that I advocate after 30 years of clinical experience are available at eiffelhealth.com. They are the most effective foundation medical nutrition supplements currently available anywhere in the world, in my humble opinion. So visit eiffelhealth.com now, immediately. Because for goodness sakes, you don't know what you don't know. And when it comes to medicine and health and what to do to give your body a leg up, the stuff that you didn't know is going to hurt you. Might even kill you. And I don't want to be an alarmist, but look around. Everybody is sick. Alzheimer's skyrocketed. Autism skyrocketed. Heart disease rates unchanged. After 30 years of statin drugs to the tune of $25 billion a year in sales, you've got to be kidding me. Obesity, out of control. Type 2 diabetes, out of control. Arthritis, rising. What's going on here? Well, we've taken the wrong dog to the hunt. Your medical doctor does not know what to do to make your body healthy. That's my profession's job. Your medical doctor may be the nicest person God ever created, but they don't practice medicine. They practice allopathic medicine. And allopathic medicine is disease management. There's a difference between disease management and healthcare, right? If conventional medical doctors were taking care of your health, you'd be getting healthier, not sicker. It's really pretty straightforward, pretty simple. From the proper perspective, everything makes sense. Ladies and gentlemen, you don't know what you're missing. Give your body the nutritional support that is its due. EiffelHealth.com for all your nutrient needs. EiffelHealth.com. Check it out right now.